when it came to substance use disorder was I had several professors, physicians, basically tell us that, if somebody is using drugs, they're really not worth working with. Um, yeah. Um, and what they meant by that was they felt that they would take up so much of our time and resources that we wouldn't be able to spend the time that we needed to with the patients that mattered, uh, which is just a terrible thing to say. And in my early years, um, I took that into my practice. I remember this young woman who came to me for help, and she had gone to a surgeon and was getting pain pills from the surgeon, and it was a long way for her, and wanted me to work with her, and I agreed to work with her. We talked about how she would go to physical therapy, and our goal would be to get her off of them. She was only in her 30s. Had this contract that I was given to during my training that outlined her responsibilities. We got a drug screen and records and everything checked out. She was only taking the pain medication, and so we started working together. And over several months, she was going to her therapist visits, and things were going well. And then, at some point down the road, she came in for a random drug screen, and other substances were in her urine. And I followed my training. I took out the form letter that one of my preceptors had given me that said that you broke your contract and we're no longer able to care for you. Please find another doctor. Put her name in it, signed it, sent it in the mail. I'm embarrassed to say that's what I did. She came in a few days later, ripped up the letter, threw it in my receptionist's face, started yelling and screaming. Dr. Cooke cut me off. What am I supposed to do? Tore things off the wall. We had to call police because she was just the behavior part of things were just out of control. They came and was taking her away, and I remembered my Aunt Sally, who was in her 30s when she actually died of a drug overdose after having been arrested and going to inpatient programs over and over again. And eventually she died of a drug overdose. And I was worried about this young woman. I asked what help would be there for her. And the officer just, shrugged and walked away. And, looking into things, at the time, there really wasn't a lot there. So it really kind of motivated me to look into things more. And long story short, through my journey, I connected with some addictionologists, did a lot of research, and started understanding that this is a disease, not a moral failing. And eventually, became board certified in addiction medicine and a fellow of ASAM now. And, I look back on that and just can't believe I did that. Interestingly, I met this same young woman in the emergency department, goodness, years and years later. She'd come in for abdominal pain. I walked in the room and I recognized her. She recognized me. It was a really weird interaction. But I sat down and reassured her that I would help her. And I started doing a workup. And the guy with her gave me this letter that she had been carrying around with her he said for a few months, maybe a year. And it was addressed to me. And he said she was just afraid to mail it for some reason. And it describes how, she grew up in a very poor home where there was substances used, and she never felt like she belonged and was cared for. And when she was around 13, she went to a dentist and was prescribed a pain pill. And she didn't know what it was. But she said in her letter, it made me feel okay for the first time in my life. And so, of course, a 13-year-old feeling okay for the first time in their life, they would continue to seek that. It wasn't until, 18 or 19, she started realizing what she was doing. And by then she was already, addicted to this, and would do just about anything to feel okay and to get that. And this continued for a while, and then she She came to me. In the letter, she said, you found out that I was using other things, and I don't blame you for kicking me out. I just want help. I don't want drugs. Will you help me? And as I said, I was embarrassed that I treated people this way, and I felt this weight lift off my shoulders that I had this other chance. And then I pulled up her CT result, and it said metastatic cervical cancer. Um, and metastatic cervical cancer shouldn't happen, because with screening and access to preventative services, no woman should ever die of cervical cancer. And I had personally cut her off from the preventative services that she could have accessed. And so, these policies, these decisions, these ways that we punish people, again, they harm people, they kill people, and we need to get away from that. And that's what I've learned, very firsthand, is that these are human lives. These are mothers, these are brothers, they're fathers. They're valuable members of our community, and to be able to connect with them on a human level is what we just have to get to being willing to do.